with us in our series of Back to Campus webinar. And as you are aware, we have been curating such sessions to understand the various nuances which are associated with returning safe return to the schools. And as you all are aware, that parents are actually confronted with the dilemma whether to send their children to school from the safety perspective. That's one aspect, and whether and the other dilemma which they are confronted with is they are well aware that the normal life which is there on the campus, which is being missed by their children. So, well, going forward to answer these questions and also to demystify myths which are related to COVID and related issues, we have a very special guest with us today, Dr. Vivek Nangia with us, who is the Principal Director and Head Pulmonology, Max Specialty Hospital, Saket. Thank you so much, Dr. Nangia, for joining us today. And we have with us our Chair of FICCI Arise, Mr. Manit Jain. So going forward, I request Mr. Manit Jain to deliver his address and set the context for today's session and take forward the session. Over
Thank
to
you
you,
so
Manit.
much. Thank you so much, Sumit. And thank you, Dr. Nangia. For those of you who are in Delhi, you obviously know Dr. Nangia. There are probably very few doctors in the world who've handled as many COVID cases as he has. He could be a Guinness record holder for that. And all kinds of cases, all ages. So he heads pulmonology at Max, besides the designation that has been shared, and all of COVID is managed under his guidance in the top hospital in the city. Thank you so much, Dr. Nangia. And when I spoke to him a few days ago, he was kind enough uh, to understand the cause that we're here for. Uh, in many of the countries across the globe, schools have opened. In fact, they shut down schools for a very short while in many of the countries. In fact, I remember I attended a McKinsey webinar uh, around May, and we were told that almost 90 countries who had gone into lockdown had reopened schools after the lockdown by May. Of course, the situation has been pretty bad in India, and we find that policymakers have also not given the learning losses the due attention that they should have got. For example, even in policies like who do you prioritize for vaccinations, many countries like the US have put teachers as frontline warriors because they're desperate to get schools reopened. They recognize that there are significant economic factors that come into play. Um, and then there are just so many myths around the disease, around the spread of the disease, and we see so much fear mongering even around the vaccines and everything. And we've read all kinds of conspiracy theories in the last few months. And I'm inviting now Dr. Nangia to give us a presentation on how schools could move forward before I move into the question and answer mode. Thank you, Dr. Nangia, once again. Welcome. Sir, you'll have to unmute.
So, good evening, everybody. At the outset, I'd like to thank Mr. Manit Jain for inviting me here to address such an august gathering. Really, it's indeed an honor and a pleasure for me to be sharing my thoughts here. COVID-19 is a disease which started from the animal market of Wuhan district of China, but has been rampaging across the globe. It has affected crores of people, killed millions of people across the globe, and is not showing any signs of abatement. It is probably the worst natural calamity that we've had to face in our lifetime. And let's hope that we don't have to face another one of this magnitude ever again. Not only the global economy has been shattered, the businesses are suffering, and there's a widespread paranoia and fear that of people contracting the infection. There's so many myths, so many rumors around it. But if we were to go by what WHO said long time back, that coronavirus is going to become endemic soon, like HIV, and may never go away. This would really become a part of our lives, and we would continue to have to live with this virus. This is not something which will just die down one day or go away one day. As you can see, the numbers were coming down, down, down. Again, in the last few days, numbers have started to go up a little. So we need to learn to live with it. For all those people who think that once the vaccination takes over, once 70-80% of the people are vaccinated, there will be a herd immunity. We'll be free to roam around without masks, without any protection, just back to normalcy. Well, let me tell you that if we go by this data that was published in TOI some time back, that if we presume that 75% of the people of the world have to be first vaccinated to get that herd immunity figure, then it will take at least 7 years to achieve this number. So imagine we are in 2021 now. So probably by 2028, we'll be able to vaccinate 75% of the population and then say yes, and that too with 2 dosages, and then say yes, that we have the entire world vaccinated and we are safe to roam around now freely. Now, the moot question that Maniji was also saying, that does shutting down of schools contribute towards the control of the pandemic? Well, in the beginning of the pandemic, yes, we did not have a choice. There was limited data available. Closing schools made a lot of logic and a lot of sense. However, there are multiple studies which have shown that transmission of the virus in the young children, from young children to adults, may not have as a strong a theory as initially thought. In fact, the voluntary behavioral changes, like wearing a mask, maintaining a distance, keeping your hands clean at all times, had a 3 times stronger reduction in the incidence and mortality of COVID-19 than just the closures of school. Right now, according to this study, this is of course is from the US, and I'm sure this is applicable across the globe. Students are beginning to feel the effects of social isolation by showing signs of anxiety and depression. And I see that in my own house, my own daughter, who's of course college going, but still I can feel that anxiety and depression and wanting to go out now after having been confined to the 4 walls for almost a year plus now. Parents are also getting exhausted as they help their children with virtual learning all the time. As far as transmission of COVID by children is concerned, it appears that children less than 2 years are less likely to become infected and less likely to spread infection to others, although further studies are needed. Children less than 10 years. Children more than 10 years may spread it as efficiently as adults, but how much is their role in spreading the infection? We still have to have insights, have to have more detailed studies. There is this very good article that has been published by UNESCO on the adverse consequences of closures of school. It basically talks about the severe impact for the most vulnerable, economically weaker children and their families. It has resulted in lesser opportunities for growth and development due to interrupted learning. Many children and youth rely on free or discounted meals that are provided at the schools, resulting in poor nutrition for the children. Transitions to distance learning platforms tend to be messy and frustrating even in this era for the teachers. It is sometimes confusing, stress, there's sometimes internet connectivity not working fully, there are drops in signals, so it cannot be as efficient. Parents are struggling to perform this task, especially those with limited education and resources. So parents are also unprepared for distance and homeschooling. Challenges creating, maintaining, and improving distance learning presents enormous challenges, both human and technical. According to the same article, it talks about the high economic costs which are involved because working parents are more likely to miss work when they have to make their children attend school, resulting in wage losses and tending to negatively impact their productivity as well. Healthcare workers with children cannot easily attend work because of childcare obligations that result from school closures. And again, I have a first-hand experience of one of my colleagues experiencing the same problem in our unit, where her 4-year-old child, could not possibly log in at home on her own. The domestic help, the nanny that they had was not so educated to be able to log in on her behalf. So the poor lady had to skip work in the morning hours, get the child to attend the classes, and then come to hospital for work. So actually, even the healthcare was getting affected because of this. She was actually attending to COVID patients in the hospital. Imagine how contradictory the situation would have been for us. Working parents often have to leave children alone when schools close, and this can lead to risky behaviors, including increased influence of peer pressure and substance abuse. There's also could be a rise in the dropout rates. It is especially a challenge to ensure youth return and stay in school when schools reopen after closure. This is especially true of protracted closures and economic crisis. And then, of course, there's always a fear of social isolation because as social contact has reduced significantly. There are also challenges in measuring and validating the learnings. Examinations, especially the high level ones like your board examination of 10th class and 12th class, they are not easy. They are the ones which actually determine the child's entire career, future. So conducting these exams, practicals cannot happen. All those are very, very logistic issues that need to be considered when you're thinking of closing down the schools. Online classes have their own disadvantages. It's difficult for a teacher to pay attention to every student. It's also dependent on a lot of factors like availability of necessary gadgets, availability of the high bandwidth internet. Families belong to the economically weaker section may not have an access to the internet or the devices or the gadgets. Practical work suffers. There's no experimentation happening in the labs as we used to do at our times. Outdoor activities like sports, SUPW are not possible, especially for those it matters who wanted to carve out a career in either sports or in their passionate hobbies. All that is not possible now with the online classes. And this is not an uncommon scenario to see where the children have switched on, logged into their classes, and have actually gone off to sleep while the class is going on. So are we ready to go back to school? Well, the first and foremost is that we have to be very clear of the local epidemiology. I am not in any way saying that all schools should open if there's a pandemic going on and the number of cases in the area are really high and difficult to manage. This has to depend on the local epidemiology, the local statistics, the local data, and after the due permission with the local health authorities. Other factors that determine reopening of school include transmission intensity in the area, close coordination with the local health authorities, the capacity of school and education institutions to operate safely, and range of other public health measures which are being implemented outside the school. So let's focus on the safety measures that need to be implemented in the schools before they say that we are ready to open and welcome the children. First and foremost, it is important to constitute a team which comprises the staff members, faculty members, defined well designated faculty member, somebody from the administration, somebody from amongst the Parents Teachers Association, the parents, and students also if possible. The four most important things that all schools need to keep in mind when they decide to open up are promoting behaviors that reduce COVID-19 spread, maintaining healthy environments, maintaining healthy operations, preparing for when someone gets sick. We need to remember that there are three main modes of transmission of this disease. One is the droplet infection, the other is the airborne infection, and third is by contact, direct contact or indirect contact. When I say droplet infections, again, droplet is also through the air only, and there's a direct airborne infection also. So the most important thing that we need to take care of is self-discipline. If any child or any staff member is feeling unwell, feeling sick, he should not come to the to school and stay at home. We must learn to cover our coughs and sneezes with a tissue, with a handkerchief, or if nothing is available, then probably the elbow, the arm, where you can actually cough in, and then that would retain the secretion and not allow it to spread in the environment around them. This is what is called safe behavior, cough etiquettes, and self-discipline, that if you're running fever, do not move out of the house. In fact, I would suggest in this time and era, if somebody's running fever, the first thing one should do is isolate himself or herself from even the remaining family members. This is not the time where we should be insisting on attendance, that it has to be 80%, 70%, not worry about absenteeism at all, but just that we want to come back to normalcy to some extent. That is why we want to open up the schools. And of course, there are certain advantages also. There should be a protocol for entry, like check the doors and gates, they're open. Nobody has to be touching the gates to open them repeatedly. So they just be left open for say 30 minutes or 60 minutes. That is the period during which the children are allowed to enter. Similarly, at the time of exit also, there's a separate entry and a separate exit if possible, which should be staggered over a period of time so that there's no crowding at the gate. There is no touching of any surfaces when they are entering. One must ensure that arrival and departure times, there is adequate time available for the students to stagger themselves over a period of time. One should also verify that each student is carrying his or her own mask and maintaining the social distance of at least 6 feet between two of them. All students should be subjected to go through the temperature check, use the hand washing station with soap and water before entering, and then go directly to the class and not keep loitering here and there in the corridor. It's always a good idea to have various signboards and stickers across the school to keep reminding students of the COVID-19 safety precautions. As I said, one of the most important strategies which helps in controlling the spread of the disease is wearing masks. Masks would be different in nature, the N95 mask, the usual cloth mask, the protection. Basically, what you need is something that could cover your face, cover your nose, cover the mouth, so that if there's a cough, if there's sneezing, it does not spread to others, one, and two, that you're also protected to some extent from somebody else's droplets and whatever extent it may be, but it's still worth it. Children less than 5 years should not be required to wear the mask. Children between 6 to 11 years, there could be a risk-based strategy where they could be wearing masks if possible, especially if the intensity of transmission is very high in the area. Is you have to ensure that the child has the capacity to comply with it and wear it properly. Now, when I say wear it properly, please remember when you're wearing a mask, it must cover the nose, the mouth, and go right up to the chin. Only then will it provide a snug fit. Otherwise, if it is loose, dropping down below the nose, as happens most of the times, or if somebody is pulling it up and not covering the chin, then it's very likely that it's not serving its purpose at all. Therefore, the mask should be snugly fitted. The other thing that you should remember is once you've touched the outer surface of the mask, then you must clean your hands either with soap and water or with 60% alcohol-based hand rub. Otherwise, whatever the bacteria or the viruses are present on the outer surface of the mask, they're very likely to come onto your fingers, onto your hands. And if you touch your mucosas like the eye, the nose, or the mouth, then they're likely to transmit the infection. So again, the entire purpose of wearing the mask will be defeated. Children and adolescents 12 years or older should follow the national guidelines of wearing the mask at all times. Teacher and support staff would be required to wear the mask, except when they are delivering lectures and are ensuring that they're at least 6 feet away from the children and the other people. Then, of course, we could have multiple stations of hand sanitizers across the school. In every classroom, probably a couple of them. Then in the corridors, there should be hand stations where, like in the hospitals we have, everywhere there are these hand sanitizers available. In fact, we always carry our own hand sanitizers in our pockets. Also, let me show you one of them here. Something like this, a small little bottle that they can carry easily. The schools should ensure that there is adequate supply of soap, the adequate supply of water, paper towels, hand dryers, hand sanitizers, disinfectant wipes, and if possible, there are those no-touch or foot pedal covered trash cans to dispose of the various stuffs. Then it's also important to maintain a healthy environment by cleaning and disinfecting the frequently touched surfaces very often. One should avoid using shared objects, for example, gym equipment, physical education equipment, art supplies, toys, games, books. The children should carry their own stuff, use their own stuff, and carry it back with them, and not be exchanging stuff in the schools. If shared objects are used, then these objects must be properly sanitized. The child must wash his hands before taking it. and must wash his hand after the use of the equipment. Ventilation in the classrooms is very, very important. If you have air-conditioned classrooms, then probably HEPA filter is your answer. Otherwise, since the weather is not so bad, it's always a good idea to keep the windows open. You could also have exhaust fans to clean up the air from inside. If you have AHUs, air-conditioned classrooms, then probably you could have 6 to 8 air exchanges every hour, which will be sufficient to clean up the air from the virus. A modified layout is what is recommended to have in the classes. There should be like the desks should be kept 6 feet apart. The desk should be turned with all the faces in the same direction and nobody sitting face to face with each other. This is like a typical distance that should be maintained between two desks. The learning stations and activities should be fewer people per group should be there, placed at least 6 feet apart. This is what a typical classroom would look like, where there are exhaust fans, windows that can be opened, teacher is standing at a distance, this mask is probably not required, and there is a path that everybody follows and does not cross it. You could have similar kind of stickers in the corridors to define the direction in which the child has to walk. We could create one-way corridors, but at all times, 6 feet distance should be maintained between two kids. Even in the common places like the toilets, there could be transparent shields like this, partitioning between the two sink areas. There could be flexible screens, or if not, then probably just shut down one and only use one at a time. And again, staggering and different timings would really help in lessening the crowd in the common places. Assemblies in closed halls should be avoided. You could certainly have them out in the open, which is not a bad idea. Then as far as food services is concerned, I'm not sure whether we are serving food in the schools these days or not, but it's not a very good idea to have self-serve food or drink options. We should only be providing pre-packaged meals or plated meals. They should have, children should preferably be sitting outside to eat because that is the time when they would be taking masks off. See, you see, even in the parties where people meet and catch COVID and come back, it's mostly at the time when they've taken off their masks and are eating together in herds or in small groups. What is important is that when you're eating, one is that you should be eating at different times and be away from people at that time, because that is the time when your mask is going to be down for sure. Again, one must ensure that children do not share food or utensils. Disposable food services are always better. All non-disposable utensils and equipment should be handled with gloves and washed with dishwater, dish soap, hot water, or in a dishwasher. Tissues and no touch of food pedal trash cans should be provided wherever possible. And one should install touchless payment methods, and hand sanitizer should be provided before and after. Having a staggering schedule in the schools is not a bad idea at all. Call one group to the school on Monday, another group to Tuesday. Like you have the odd and the even schemes. Similarly, according to the roll numbers, they could be called to school. So it's only 50% attendance. The remaining 50% could probably attend online. So even if they're attending 3 days in a week, there's absolutely no harm. And of course, one can always sit down and work out various schemes where everybody benefits, and yet there can be a blended learning or a hybrid learning program that they could adapt to. Then even for their entry, exit, lunchtime, sports time, it could all be staggered over the day, make it more flexible for the child to come and go, and with least interaction and least crossover. This is what I was talking about, like a hybrid learning program where half of the class could be attending remotely, half of the class could be in person, and on alternate days, they could be coming and going. As I said earlier also, we could have posters like this all over the school to spread the awareness. You could also have public address system, which is continuously relaying a message saying that these are COVID times and be careful, maintain distance, keep your hands clean, and keep your masks on, like we have in our hospital, which is running 24/7. So it's not a bad idea to have this kind of a message going on all day long. It's also, one has to identify a designated point of contact. If some child or some staff member was to fall sick, They could report to the school nurse, who could then liaison with the nearest healthcare facility or the local health authorities, so that it's totally seamless and safe for everybody. The precautions need to start from the school bus itself. In the school buses, one should maintain 1 meter distance between two children. There should only be one child per seat. Masks should be made mandatory. Windows should be kept open. There could be a transparent partition between the driver and the children. And of course, the child must carry their own hand sanitizer and keep cleaning their hands every time they touch any surface, which is common to everybody in the bus. A couple of common questions that people ask: that should children with underlying health conditions like bronchial asthma, etc., return to school? Well, they could, with certain special precautions to minimize the risk of infection among them. Similarly, another question that is commonly asked is that should teachers or other staff with underlying health conditions return to school? Well, we all know that people above 60 years of age and people with elders with certain comorbid conditions like hypertension, diabetes, heart disease, lung disease, they're all more prone and susceptible to catching COVID infection and its complications. So that'll have to be an individualized kind of a decision whether they want to come or not, and again would depend upon the local disease trends. So to summarize my talk, we must remember that fallout from this pandemic will likely last long after the virus has receded. It's important to acknowledge that COVID-19 policies are intended to mitigate and not eliminate the risk at all. We need to learn to live with it. No single action or set of actions will completely eliminate the risk of SARS-CoV-2 transmission, but implementation of several coordinated interventions, which include maintaining social distance, hand hygiene, wearing masks, can reduce the risk of acquiring the disease greatly. There are certain benefits of reopening the school, like returning back to a sense of normalcy, sharing practices, hygiene measures, and allow students to complete their studies and continue to the next level. Essential services, access to nutrition, child welfare, such as preventing violence against children, would be prevented. There would be a sense of social and psychological well-being. One get an access to reliable information on how to keep themselves and others safe. It will help in reducing the risk of non-return to school and will definitely benefit the society at large by allowing the parents to go back to work. These are just a summary of the various measures that I've already discussed. So I'll just skip this for paucity of time and would like to thank Manoj ji for inviting me for this lecture this evening.
Thank you so much, sir. Thank you so much for your insights. And, one thing is becoming very apparent, and you have absolutely no confusion about that, that the disease is here to stay and it's going to take a long time. Now, when you say that, it is all the more important for us to recognize that we can't, because we can't wish it away, we cannot have schools shut, and we will have to reopen, whether it is in a staggered manner, however we manage attendance, whether it takes a lot of expense in making sure that uh, the safety is taken care of, whether it's sanitizers, dividers, whatever it is that we need to do, we will have to invest the time and resources in taking all those measures to ensure that children are the safest possible. Yet we all know that if kids are going to be on campus, there are risks. They cannot be supervised at all times. They would like to socialize and they would like to bend rules. I think they've also been itching for some of that for such a long time, and naturally so. So one thing that I'd really like to understand, you spoke about the different modes of transmission. Uh, I think, and we all meet people across the spectrum. There are those who are so paranoid that they still haven't left home, and would probably think that if they crossed somebody on the street, on an open street, for a second, and the person had coronavirus, they'd probably get it. So what is this susceptibility realistically? I mean, what is this? viral load that people are talking about? What does it take for someone to get infected?
See, basically, it has to be an exposure to somebody who's already suffering with the illness, who may be asymptomatic or symptomatic. Then again, there's a low risk and a high risk of exposure that it would depend upon. High risk exposure would be to be in close contact with somebody for more than 15 minutes without the mask. That is considered at high risk. Not if I was just to cross somebody in the corridor would I catch COVID. No. And especially if I'm wearing a mask, the chances are very, very low. But
Right.
if I was to sit down with somebody for 15 minutes in my room, closed room, no ventilation, and somebody is literally coughing on my face without a mask on, then there's a very high probability that I would acquire COVID and walk back home with a COVID infection.
Right. So you're not going to get it in thin air, right?
No, 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 not at all. And not even by just crossing somebody or, by when you're wearing mask, you're pretty safe. See, we encounter patients every day. Even today, I saw somebody in the OPD who came to me with cough, cold, and I suspected him to be having COVID. I've sent him for a COVID test. So as long as I'm wearing a mask and keeping my eyes covered, I'm pretty safe and well protected.
Right. So my second question is around social distancing. Many countries talk about 3 foot. Uh, there are also countries that talk about 6 feet, and for us in India, it's always been 6 feet. Particularly in classroom environments, it is practically impossible to maintain 6 foot distance. Is that something that you recommend when students are not wearing masks, or when they're wearing masks, this distance can be reduced?
Yeah, that's a very good point and a very valid point that you made, Manaji. That yes, if you're wearing masks, then probably 3 feet distance is more than sufficient. If you're
Right.
not wearing a mask, then you need a 6 feet distance because that would be the distance at which the droplet will fall. But if you're already wearing a mask, then the probability of coughing and the droplet coming out as it is very low.
Right. So we could manage with about a 3 foot distance if we're wearing masks.
Sure.
And we should also perhaps encourage kids to be at a slightly greater distance when they're speaking, because they're
Absolutely.
most likely to, if they're quiet, if they're not speaking, just breathing through their nose, and the nose is covered with a mask, they're fairly okay. They're not likely to spread it. And
Absolutely.
you insisted on another thing. If we can in air conditioned classrooms, if we have treated fresh air, even if it is not heat treated, even if it's just getting recycled, and we do have some fresh air coming inside the room, maybe doing 6 to 8 rounds in an hour, we should be fairly okay.
Yes. And especially if you have HEPA filters, then even better.
Then even better. Yeah, the challenges with having HEPA filters is that it's not easy to, then the level of equipment required for filtration may be very difficult to augment for many people, because the duct sizes, everything, so particularly in centrally air conditioned plants. uh, and maybe it's time for us to say, okay, if there's one window in the classroom, let's open it regardless, even if
Absolutely.
the air conditioner is running, or let some fresh air come in somehow. That could be a good solution. So long as we have fresh air, we have
Basically, you have fresh air coming in and you
masks, and we
absolutely.
maintain about 3 foot distance, we are likely to be in a safer place. There is no foolproof method. Things are going to happen. We will probably not be able to wash them in toilets, whatever. There are kids are going to test boundaries and do things. We know adults are testing boundaries all the time. So that's something that cannot be guaranteed. Now, in the events that one gets the infection, or one is suspecting some kind of symptoms, what kind of protocols should we follow? Like if a child starts coughing, and the teacher notices that there's something happening, or the child is complaining of a headache or fever or something like that, um, how do we go about it? So I can tell you, we've had questions like teachers saying, okay, then am I not risking myself if I'm taking the child to even the clinic?
Yeah, so that's a good question. So basically, you will have to have the school nurse play a more active role in this kind of situation, where if you're suspecting anybody to be developing a cold, cough, and fever, first of all, the symptoms usually don't come so abruptly. Symptoms are usually there, and I think the parents and the student himself or herself needs to be more aware of those symptoms, even the mildest symptom, and one should stay back at home and not go to school. That is one thing that you need to remember always. Second thing is that despite that, if during school hours somebody does start to cough, somebody does start to run temperature, then I guess the best thing is that the child has to be isolated. Now the issue is that who will escort this child to a designated area where you can keep the children isolated. It has to be the school nurse who would have to wear a PPE and then escort this child to the designated area, and
So
then be in touch with the local authorities, where immediately, in any case, it doesn't make any sense to test. You should only test after 24 to 48 hours of symptoms to be sure that you're getting the right catch.
right. Let's evaluate the risk in that. If the teacher is wearing a mask, and if the teacher is walking at a safe distance in an open corridor for 4 minutes to get the child uh, to the clinic, are there significant risks even if the
So
child had
without
the
touching,
infection, if the child
yeah.
was positive?
So I was actually thinking of a child
Without
who
touching,
need to be handheld and then walk down. If that is not the case, then it's safe.
it's safe, right? So unless the child is in a situation where the child will have to be picked up or
Carried or
held by the
something.
hand or held close or is really shivering or something, it may not be so risky to take the child out to the clinic, right? So about vaccination, one of on behalf of the entire education community, one of the requests that we have for the healthcare community is to make a case, to help us in making a case to prioritize vaccinations for teachers, for educators. It's as through your presentation and in general, we're all aware now schools need to reopen. We can't, if it's this is going to take 7 years, we can't wait for 7 years. uh, we would really urge you to make this case to ICMR through your hospital. I mean, you're an influential uh, healthcare professional yourself. We would really urge you all to make that case for teachers getting vaccinated as quickly as possible, because it is normal that they express a lot of fears. Uh, Many of them come with comorbidities themselves. Many of them have parents who have comorbidities and who worry that if they take the infection back home, it can be very, very risky. Uh, Now, in terms of vaccinations, now that we're talking about it, uh, uh, what has been your, I mean, there's research, of course, which is showing up, but the studies are still going to take some time, right? Now, recently I was reading an article which spoke about this clotting issue with COVID Shield, and I don't think we've had very many cases in India so far, not reported cases at least, and with the millions of people who've already got the vaccine, are the risks seeming significantly more than they would be in a control group in any case?
So that's a very interesting question. Of course, this is a debatable question, one, and two, that the research is still ongoing. We
Right.
must remember that these vaccines have been produced on a very fast track kind of a manner, but at no times has the scientific data been cut short, or uh, has the emphasis on the quality of the data been compromised at any stage.
Yeah.
Quality on the quality of manufacturing, as well as the rollout plan, everything has been done very, very systematically. So that is not a question, and you cannot debate it at all. The only debatable point is that what are the side effects that we are observing now? Were they observed earlier? Well, they weren't. Even now, whatever we have observed, like earlier when the vaccine was launched, there were some In Norway, there were some 1921 deaths or something, which later on we realized that they were not linked to the vaccine. Now, again, initially, the European Union had banned AstraZeneca for their Covishield vaccine. Some of the countries of European Union had banned it. But again, if you read yesterday's news, it says that the ban has been removed, it's been lifted, and the vaccine is available again. And they are continuing with their vaccination plan because these episodes of clotting were not found to be linked to the vaccination. Even if they were, these were not life-threatening events. See, you have to remember, COVID is a disease which results in death. Vaccination, even if it has a complication from which you can recover, there is no problem. If in India the mortality rate is between 2 to 3%, in the other part of the world it's probably higher than that because of whatever reasons. But out of 100 people, 3 to 5 people are dying because of COVID. Whereas with the vaccination, there's not been a single death. Even in people who acquired COVID after receiving the vaccination. Of course, there would be 20% or 10% people who do acquire COVID after receiving the vaccination. In them, the disease is very mild and none of them have lost their lives. So that is what the importance of the vaccine is.
So the
Vaccine is considered to be the most important most important discovery as a preventive measure for health. So it cannot be ignored, it cannot be neglected.
Right. So you're saying basically that everybody should go out and get the
Absolutely.
vaccine
All and
as
all out and get
early
the
as they
vaccination.
can. That's the only way we're going to get ahead of the disease. Otherwise, this is going to cost lives. This is going to take longer.
In
Uh,
fact, every day I get lots of calls that I have asthma, I have diabetes, I have hypertension, I have heart disease. Should I be taking the vaccine or not? Well, these are the people who are more at risk. They are the ones who actually qualify, even if they are younger, to receive the vaccination. So there is no disease in which you have to withhold the vaccination. The only three contraindications, I mean, the three category of people who cannot be taking the vaccine as of now are children less than 18 years of age, pregnant ladies, and lactating ladies. That too, not because of any safety risk. That too, because we only have not been able to try them out in this category of people yet. But
right.
very soon, I'm sure, with the ongoing trials, they would be tried in these three groups as well, and be found to be beneficial. There's no reason to withhold the vaccination even in them, except for the fact that they've not been tried out yet, that we don't have enough data to support that yet.
So, sir, you're not at this point of time, it would be safe to say that it is not a situation that you're vaccinating 100 people in your hospital and five of them are coming back and saying they had heart issues or they got something or they developed some life-threatening symptoms of any kind. You're not practically on the ground, you're not seeing that.
Mild side effects are very common with vaccination, and that happens with any and every vaccination.
Right.
If you remember your own childhood or your own children or grandchildren, when you take the child for a DBD vaccine, you know the next day the child will develop fever. So preemptively, you give them a crocin or a brufen or a combiflam or something of that sort. This is also something similar. Mild side effects like tingling, headache, loose motions, low-grade fever, redness at the site of injection, pain at the site of injection are very, very common. You just ignore them. People could be having fever up till 2 to 3 days. Doesn't matter. You just ignore them. Take paracetamol and bring it under control. But
Right.
moderate to severe kind of adverse reaction are very rare with any vaccine and also with this vaccine. We haven't seen even a single severe reaction to this vaccine.
And
But
you've been
in any case,
administering it for over 2.5 months now.
and 100 patients every day, more than that probably.
So we've not seen any significant adverse
In fact,
reactions so
it is
far.
mandatory just to ensure that it's safe for everybody. It's mandatory for everybody after receiving the vaccine shot to be kept under observation for half an hour. But luckily for us, we haven't seen any major side effects so far.
Right. So, sir, in terms of our own management of the disease, also, I'm sure we've made a quantum leap in the last 1 year. Uh, our knowledge of the disease, our knowledge of whatever treatment protocols are available, uh, and are you seeing that the fatality rate in some ways is falling? Are the strains getting weaker? Is this becoming less virulent, the disease, or it's still more or less the same?
Well, that is a little difficult to say that the disease is becoming less virulent because there's no basis for me to say that. But luckily for us in India, the mortality rate has been around 1 to 2% only, and we're still holding on to that figure. Whereas in the rest of the world, it is touching 3 to 5%. So that way, yes, we've been lucky. Our healthcare has been better equipped to handle the pandemic, and so far we've done a very good job with it. And
And
yes, over the last 1 year or so, we've been able to now streamline our management protocols. SOPs are in place. Most of the things now happen in an auto mode and do not require much intervention. And yes, the recovery rate is certainly better and higher than in any other part of the world.
what would you say, sir, in terms of those without any comorbidities or of a significant age, if we were talking about uh, healthy individuals, say middle age, 40, 45, does this fatality rate get lower there?
So in
Say
my
30 to
practice, of
50
course,
year
I don't
old?
have any data that I've published anywhere, but what I've seen in the last 1 year plus
Right,
is that children less than 18 years have an uneventful course completely. They only have a mild kind of a disease, like a simple cold and cough, which
right,
goes off in 3 to 5 days at the maximum without
right,
any medication.
right,
Then people till the age of 30, 35 years of age again have a very mild disease in whom we don't even get the basic investigations done, and they sail through very comfortably. In them, we are using antiviral drugs, but again, in the oral form and at home only. We've not had to hospitalize so far, touch wood, God's grace, anybody below 35 years of age in my unit at least. One or two people did get hospitalized, but they were more out of their own panic reaction than a clinical requirement.
right.
Then between 35 to 50 years of age group, I would say we've admitted probably 10% or 20% of the people, all with a 100% recovery rate, who have gone back home safe and walking. 50 and above is the category where, with or without the comorbidities, things do turn a little dicey. But again, as I said, only about 10% of the people had a moderate to severe illness. About 5% required ICU care, and overall mortality has been less than 2%, which is hardly any.
Right. So, sir, then, when I'm adding these two things, that below children below 10, really very, very, very low risk to themselves. And if their parents got vaccinated, their family members got vaccinated, who may also themselves, for the most part, be below 50 years of age, likely, given what we see in our country, for the most part. Uh, we should be okay to open at least primary schools, and that's the trend that we've seen across the globe. While here we are pushing for senior schools opening first, and some of it because of examination kind of reasons, but we've completely ignored the primary and the pre-primary, and we all know that even at the pre-primary stage, that's the time when the pace of brain development is the highest, and it needs to be nourished. It's building those synapses. It really requires that stimulation. So that makes a very strong case for opening schools for younger kids. Perhaps even when you're talking about masks, not UNICEF is talking about it, you're not talking about it. Masks are not necessary for kids under 5 years, and 6 to 11 can also be wearing them intermittently. We need to figure out, if you're able to manage safe distancing, then they probably don't need it all the time that they're in school. Um, we really need to push forward and get these kids back to school, because the online transaction is far more manageable for the older kids. But the younger kids in an online environment are not able to get as much as the older would. So really, we should all push for that. There's one question there Isn't fomite transmission less of a worry as per latest research? Fomite is transmission through objects, through surfaces. Dr. Nangia?
Yes, it has been. So it has been recently realized that the transmission through fomites is not as much as it is through the droplet infection. But then again, it cannot be ignored. You still have to continue taking the precaution of keeping your hands clean. Do not touch surfaces unnecessarily. And even if you do, carry these small hand sanitizer bottles with you. These are very handy and easy to use.
Right. So, one last question, Dr. Nangia. It's a very good question, I think. Is it safe for a child to be in a mask for long hours? I'm assuming that the child is not exerting themselves physically. They're sitting in a classroom for maybe 4 or 5 hours. Uh, and with the commute, say 6 to 7 hours in a day, if they're wearing a mask, is it a problem? A. And B, if they feel claustrophobic or suffocated or something, what must one do?
Yeah, so I don't see any reason why they can't wear the mask unless they have some underlying asthma or some other allergies or any issues. Otherwise, 6 to 7 hours wearing a cloth mask, there's usually not a problem. The only problem comes is when it is N95 mask, they're very tightly tied and you're not able to breathe through it. The carbon dioxide levels start to rise inside the body. That could be a problem. That
Right.
too, only in the if you have some underlying disorder, otherwise not. The only thing is that, again, let me reiterate that when they are out in the open at a safe distance from everybody, then probably they don't need to be wearing the mask. So again, you have to use your judgment from time to time when it is required, when it is not required. When you're in a closed environment, you wear a mask instead. When you're out in the open at a distance from everybody, then you don't need to be wearing a mask. You could be, without the mask, breathing fresh air directly.
Right. Uh, Thank you so much, Dr. Nangia. This has been so insightful. I think you've brushed away so many of the myths and uh, really learning from not just research, but also your practical experience on the ground has been absolutely wonderful. I'd now like to welcome Mr. Dilip Chinoy, who's our Secretary General of FICCI. So he handles all of what happens at the several verticals that FICCI has. Delighted to have you here, Dilip. Over to you.
No, thank you, Mr. Manoj Jain and Dr. Nangia. Good evening to all the teachers and all the educators who have joined and all the health workers who have joined. So I think both the sectors need to be congratulated and commended and applauded for keeping the wheels of both the health and education both going. Both are equally important. I think healthy, wealthy, and wise is a phrase that a lot of us talk about very often. I think I've been listening on to this conversation. I'm sorry I had to join from my phone because I was transiting between two locations and I can't somehow log on from my computer, having reached a physical location where I can do that. So I'm still talking from the phone. I think the presentation, Dr. Nangia, I think was excellent. Many useful insights into the whole challenges that we are grappling with. And I think more importantly, I think to Manit, the questions that you asked and the clarifications that you sought from Dr. Vivek Nangia and the responses that he gave, even for us, and as you said, that we are also responsible for running an office, because what applies in a classroom and in a school setting can also very easily apply in an office setting. And thank you very much for presenting a picture that literally uncovers some of the myths around reopening of schools and other education institutions, and of course some conceptions and misconceptions, and if I may use the word paranoia, around the disease, the contagiousness, the effectiveness of mass sanitization, and the debate between 3 feet and 6 feet, etc. Thank you so much for sharing your rich experience and learning. I would like to compliment Vicky Arise for doing this. In another context, I was actually addressing it as not only educators and teachers who need to be enlightened, but also parents, because a lot of the misconceptions are with parents. I've mentioned this in another context, but Dr. Nangia, you may not be aware, but I know I come from a family of educators, and it's a challenge getting the students, all students, into the classroom, and sometimes you're in a classroom doing a kind of a hybrid thing, and sometimes you're in the classroom which is absolutely empty and you're teaching students online. But I hope that this demystifying myths of COVID-19 special edition on safe return to schools has cleared some of the air, and that we will see more and more students coming into schools that are absolutely safe for not only the students to be there, but for the teachers and administrators to be there. And together, while we reopen schools and education institutions, we ensure that there is no second or third wave of COVID in the country that we are doing. So again, thank you, Dr. Vivek Nangia, and thank you to the team at Vicky Arise, Malika and Simran and Sumit to work under the leadership of Mr. Manoj Jain. So thank you. For me, it was a very educating session.
Thank you, everyone. Thank you to all the viewers who joined in, and thank you, Dr. Nangia, Sumit, Malika, and everybody in the team. We're ready to open schools. I know many of you have already started. Let's put some of our fears to rest, take the necessary precautions, and get the kids back to complete and normal learning. Thank you so much for joining, everybody.
Thank you. Thank you, everybody.
Thank you.